Hello, my name is Clint Harden. The topic for the following presentation is male Foley catheter insertion. In this presentation, we will discuss the purpose of urinary catheterization, nursing considerations, including assessment, contraindications, risks, and patient teaching, the procedure, including needed supplies and the procedural steps, and special considerations. An indwelling Foley or retention catheter is used to remove urine from the bladder in situations when there is a mechanical obstruction in the urethra or retention of urine due to a nerve block, such as after surgery, due to BPH, or in cases where urine needs to be carefully measured. A catheter may also be used when a patient must be immobilized, such as with skeletal traction, and during many surgical procedures. Here we see how a Foley catheter works. Notice the image of the Foley catheter on the right. After the tube is inserted through the urethra and into the bladder, the balloon is inflated. Urine flows down the catheter and exits the body and resides in a urine collection bag. Nursing considerations prior to the procedure include a thorough assessment of the patient and reason for the indwelling catheter. First, determine the indication for the indwelling catheter and confirm the order. Next, question the patient's history and allergy status. Ask the patient if he has a history of urinary issues or has been catheterized before and for how long it may have been in place. If the patient has urethral strictures or an enlarged prostate, this can make catheterization more difficult. Assess for latex allergy, and depending on the catheter being used, consider the use of a silicone catheter. Assess for adhesive allergies because the catheter tubing is secured to the leg using adhesive. Also assess for shellfish allergy or iodine sensitivity because the antiseptic solution provided in many Foley kits is betadine. As part of assessing the patient prior to inserting a Foley catheter, it is vital to assess reasons that are contraindicated for Foley placement. Catheterization is contraindicated if there is suspected urethral trauma or tearing. This condition may be suspected in male patients with a pelvic or straddle type injury. Signs that increase suspicion for injury are a high riding or boggy prostate, perennial hematoma, or blood at the meatus. When any of these findings are present in the setting of possible trauma, a retrograde urethrogram should be performed to rule out urethral tear prior to placing a catheter into the bladder. It is also important for the nurse to consider the risks associated with Foley catheter insertion. The main risk is infection. Catheter-associated urinary tract infections are the most common nosocomial infections. 10 to 30% of patients develop bacteria and become symptomatic within 2 to 4 days after insertion of an indwelling catheter. Though catheters may be used for comfort at end of life, indwelling catheters are not indicated to manage incontinence or for convenience at any other time and should always be removed as soon as possible. Also, indwelling catheters may also lead to renal inflammation and pyelonephritis with prolonged use. Prior to inserting a Foley catheter, the nurse should take a moment to educate the patient about the procedure. The nurse should explain the procedure and what the patient can expect to feel during insertion. This includes pressure, some temporary discomfort if there is an enlarged prostate, and then relief as urine is released. The nurse should also address concerns for modesty. Explain to the patient that they will be exposed during the procedure. However, reassure the patient that a blanket will be used to cover their legs and the curtain will remain closed to provide privacy. To perform the procedure, the nurse must gather all necessary supplies. One important item to note is that catheters come in different sizes and materials. Catheters are sized in units called French, ranging from 12 French, small for pediatrics, to 48 French, extra large, and are usually silicone, but may be latex or another material. An appropriate sized catheter should be selected. Notice that the catheter in the kit in this image is a 16 French. Items for the nurse to collect include clean gloves, washcloth and warm water for perennial hygiene, a waterproof pad, and a sterile Foley catheter kit. Again, it's important to note the size of the catheter when selecting the kit. Most facilities provide prepackaged sterile Foley catheter kits. However, if you are not using a kit, you should also assemble the following supplies: a sterile catheter in the appropriate size, sterile gloves, sterile drapes, one with fenestration. This means it has a small window in the middle of the drape. Antiseptic solution such as betadine. However, use castile soap or hibiclens if the patient reported iodine sensitivity. A sterile basin, sterile cotton balls, sterile forceps, pre-filled syringe with water, sterile lubricant, disposable urine collection bag and tubing, and paper tape or a leg strap. After all supplies have been gathered, it's time to begin the procedure. There's 15 steps for inserting a Foley catheter. As we go through the procedural steps, I would encourage you to pay particular attention to the steps that are highlighted in bold, as these may appear later in the module. Number 1, confirm the patient's ID using 2 identifiers. Number 2, perform hand hygiene. Close the curtain to provide for patient privacy and stand on the patient's right side if you are right-handed, or the left side of the bed if you are left-handed. Number 3, ask the patient to lay back in the dorsal recumbent position, legs straight and slightly apart. Slip the waterproof pad under the patient's penis and or scrotum. Keep the patient covered while you set up your sterile field. Number 4, set up the urine collection bag if a separate system is to be used, and attach it to the bed frame. Number 5, open the sterile catheterization kit on the patient's legs using sterile technique. If no kit is used, open a sterile drape and prepare the sterile field with the necessary supplies. Number 6, don the sterile gloves that are included in the kit. Number 7, apply the drapes. Lift the first sterile drape, the one with no window, and using part of the drape to protect the sterile gloves, drape the patient's thighs. If the gloves become contaminated, replace them with new gloves. The second drape is fenestrated and is placed over the patient's groin area to expose the genitals through the window. Number 8, open all the sterile supplies in the tray. Remove the plastic sheath covering the catheter. Squirt the lubricant into the tray and lay the catheter in the tray with the tip in the lubricant. Pour the antiseptic solution over the cotton balls. Unwrap and attach the 10 milliliter syringe of water to the balloon port. If no kit is used, ensure that the drainage end of the catheter is in the basin and this is within reach for urine drainage. Note, testing the balloon prior to insertion is not recommended. All catheters are tested during the manufacturing process. Also, inflation creates stress on the balloon that creates ridges and increases the surface area, which causes higher incidences of urinary tract infections and more irritation upon insertion. Number 9, clean the penis glands and urinary meatus. Using your non-dominant hand as your working and now non-sterile hand, pull back the foreskin, if applicable. Hold the penis shaft and glands and prepare to keep this hand in place until the catheter is in and urine is flowing. Using your dominant hand and keeping it sterile, use the included sterile forceps to pick up an antiseptic soaked cotton ball and clean the meatus and the surrounding penis glands in a circular motion starting at the tip, discarding the cotton ball after one pass. Pick up another cotton ball and repeat the process at least 2 more times. Number 10, insert the catheter. Using your sterile dominant hand, pick up the catheter a few inches from the tip to ensure it is coated in the lubricant. Then insert the tip slowly into the urethra and advance it until you see the flow of urine, and then advance another 3 inches. Note, If you encounter pressure before you see any urine flow, this may be narrowing of the urethra from the prostate. Turn the catheter a little and advance further, and it should slip past and into the bladder. Do not force the catheter if there is great resistance. Number 11. Inflate the balloon with the entire volume of sterile water, usually 10 mL. Do not inflate against great resistance. If resistance occurs, try moving the catheter a little further before attempting to inflate again to avoid damage to the urethra. At this point in the procedural steps, let's pause and observe how the inserted catheter appears as it relates to the male anatomy. Notice the catheter is inserted through the urinary meatus and follows the urethral tract into the bladder. Also observe how the inflated balloon anchors the catheter in place against the bladder outlet. Also, notice the prostate in relation to the urinary tract and the bladder. Remember, in males over the age of 50, an enlarged prostate is common and may be problematic when attempting to insert a catheter. A solution for this is discussed later in the presentation. Back to the steps. Number 12, attach the urine drainage bag if no kit was used. Otherwise, attach the urine drainage bag to the bed frame now and clean up all supplies. Number 13, use tape, a Velcro leg strap, or the provided securement device to attach the drainage tubing to the upper leg, leaving some slack to allow for movement. Number 14, remove gloves and perform hand hygiene. Number 15, assist the patient to a comfortable position. There are no two people alike. The following are a couple of common special considerations when inserting a male catheter. If resistance is met while inserting the catheter and rotating does not help, do not force it. Enlargement of the prostate gland is commonly seen in men over the age of 50. A special crooked-tipped catheter called a coude may be required to maneuver past the prostate. A second population that warrants special consideration is the overweight or obese male. If the patient is obese and has a retracted penis, have an assistant available to hold the patient's penis up and back. The catheter still needs to be inserted as normal, as the length of the urethra has not changed. This concludes the lecture for male Foley catheter insertion. Thank you.